Question 1. To address the challenge of ensuring comprehensive and compliant care for Medicare Advantage beneficiaries, which approach best fosters effective teamwork and patient-centered outcomes? Option A. Designating a single individual to manage all care coordination tasks without a formal support structure or communication link to the broader clinical team. Option B. Implementing a structured, interdisciplinary communication protocol with clearly defined roles and shared responsibility for beneficiary care coordination. Option C. Relying on individual providers to independently manage their aspects of beneficiary care with minimal formal team interaction. Option D. Prioritizing administrative processing of claims and authorizations above all other aspects of beneficiary care coordination. The correct answer is B. Implementing a structured, interdisciplinary communication protocol with clearly defined roles and shared responsibility for beneficiary care coordination. Explanation. Scenario analysis. This scenario is professionally challenging because Medicare Advantage plans operate within a complex regulatory environment governed by the Centers for Medicare and Medicaid Services, CMS. Effective patient care and plan compliance hinge on seamless interdisciplinary collaboration. Miscommunication or a lack of coordinated effort among care team members can lead to suboptimal patient outcomes, potential compliance violations, and dissatisfaction for both beneficiaries and providers. The inherent complexity of managing chronic conditions, coordinating benefits, and adhering to specific plan benefits requires a unified approach. Correct approach analysis. The correct approach emphasizes proactive, structured communication and shared responsibility among all members of the patient's care team, including physicians, nurses, pharmacists, social workers, and administrative staff involved in Medicare Advantage plan operations. This aligns with CMS guidelines that encourage coordinated care models to improve beneficiary health and satisfaction. Specifically, CMS often emphasizes the importance of a patient-centered medical home model and the role of care coordination. A team-based approach ensures that all aspects of a beneficiary's care are addressed, from clinical needs to administrative requirements like prior authorizations and benefit explanations, thereby minimizing gaps in care and ensuring adherence to Medicare Advantage program rules. This collaborative strategy directly supports the goals of Medicare Advantage, which are to provide high-quality, cost-effective care and a positive member experience. Incorrect approaches analysis. An approach that relies solely on individual provider initiative without a structured team communication protocol is problematic. This can lead to fragmented care, missed opportunities for intervention, and a lack of consistent information sharing, potentially violating CMS's expectations for coordinated care. If team members operate in silos, critical information about a beneficiary's condition, treatment plan, or benefit utilization may not be shared, leading to errors or delays in care. Another incorrect approach is to delegate care coordination responsibilities to a single individual without adequate support or clear lines of communication with the rest of the team. While a designated care coordinator is valuable, their effectiveness is diminished if they cannot easily access information from or communicate effectively with other team members. This can result in the coordinator becoming overwhelmed and unable to provide comprehensive support, potentially leading to noncompliance with Medicare Advantage program requirements for member support and service. Finally, an approach that prioritizes administrative tasks over clinical collaboration, or vice versa, is also flawed. Medicare Advantage requires a holistic view of the beneficiary, focusing exclusively on administrative processes without understanding the clinical context, or focusing solely on clinical interventions without considering the administrative and benefit-related implications, will result in incomplete care and potential noncompliance with CMS regulations that mandate comprehensive member support. Professional reasoning. Professionals in Medicare Advantage settings should adopt a decision-making framework that prioritizes a patient-centered, team-based approach. This involves establishing clear communication channels, defining roles and responsibilities within the care team, and fostering a culture of shared accountability. When faced with a situation requiring coordinated care, professionals should first assess the beneficiary's needs holistically, considering both clinical and administrative aspects. They should then actively engage all relevant team members, ensuring open dialogue and mutual understanding of the care plan and individual contributions. Regular team meetings or structured communication protocols are essential for monitoring progress, identifying potential barriers, and making necessary adjustments to the care plan, all while ensuring adherence to CMS regulations and program guidelines. Question 2. Analysis of a Medicare beneficiary's request for a high-end, technologically advanced wheelchair, which is significantly more expensive than a standard, medically appropriate model, presents a challenge for a durable medical equipment (DME) provider. The beneficiary states they cannot afford the standard Medicare coinsurance and deductible for the more expensive model. Which approach best aligns with Medicare Part B regulations regarding coverage, costs, and enrollment for durable medical equipment? Option A. Provide the high-end wheelchair, waive the beneficiary's deductible and coinsurance due to their stated financial hardship, and bill Medicare for the cost of the more expensive item. Option B. Provide the high-end wheelchair, bill Medicare for the cost of the high-end wheelchair, and inform the beneficiary that Medicare will cover the full cost of the more advanced model. Option C. Provide the standard, medically appropriate wheelchair, bill Medicare according to its fee schedule for that item, and clearly explain to the beneficiary their coinsurance and deductible responsibilities for the covered item. Option D. Provide the high-end wheelchair, bill Medicare for the cost of the standard wheelchair, and absorb the price difference as a charitable contribution. The correct answer is C. Provide the standard, medically appropriate wheelchair, bill Medicare according to its fee schedule for that item, and clearly explain to the beneficiary their coinsurance and deductible responsibilities for the covered item. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of Medicare Part B coverage rules, specifically concerning durable medical equipment (DME), and the patient's responsibility for costs. A healthcare provider must balance providing necessary care with adhering to Medicare regulations to ensure proper billing and prevent potential fraud or abuse. The patient's financial situation adds an ethical layer, but Medicare rules dictate coverage and cost-sharing obligations. The correct approach involves accurately determining if the prescribed equipment meets the definition of Medicare-covered DME, and then informing the patient of their financial responsibility based on Medicare's fee schedule and the patient's specific Part B deductible and coinsurance. This approach is right because it directly aligns with the Medicare Part B statute and regulations, which define what constitutes covered DME and outline the cost-sharing mechanisms for beneficiaries. Specifically, 42 CFR Part 410, Subpart C, details coverage for medical and other health services, including DME, and 42 CFR Part 405, Subpart I, addresses payment for services, including deductibles and coinsurance. Adhering to these regulations ensures accurate billing, protects the provider from penalties, and correctly informs the patient of their obligations under the Medicare program. An incorrect approach would be to waive the patient's deductible and coinsurance solely based on their stated financial hardship. This is a regulatory failure because Medicare rules generally prohibit providers from waiving cost-sharing amounts for services that are covered by Medicare, except in very limited circumstances not applicable here. Such waivers can be considered inducements to Medicare beneficiaries and may violate the anti-kickback statute and the beneficiary inducement civil monetary penalty provisions. Another incorrect approach would be to bill Medicare for a higher cost item than is medically necessary or available under Part B, or to classify the equipment incorrectly to achieve a different payment outcome. This constitutes a billing fraud and abuse violation, as it misrepresents the services provided and the costs incurred, directly contravening Medicare's principles of payment for medically necessary and appropriately classified items. The professional decision-making process for similar situations should involve a thorough review of the Medicare Benefit Policy Manual, specifically Chapter 20, for durable medical equipment, prosthetics, orthotics, and supplies, to confirm coverage criteria and payment rules. Providers should also consult their Medicare Administrative Contractor, MAC, for clarification on specific coverage or billing questions. Transparency with the patient regarding their estimated out-of-pocket costs based on accurate Medicare billing is crucial. If a patient faces financial hardship, the provider should direct them to Medicare resources or independent nonprofit organizations that can assist with understanding their benefits and exploring potential assistance programs, rather than unilaterally altering billing practices. Question 3. The investigation demonstrates that a Medicare beneficiary is seeking assistance in understanding how to use the Medicare Plan Finder tool to compare available Medicare Advantage and prescription drug plans. Which of the following actions best supports the beneficiary's informed decision-making process in accordance with Medicare regulations? Option A. Guiding the beneficiary to input their specific Medicare number and prescription drug list into the Medicare Plan Finder to generate personalized plan comparisons, and then explaining how to interpret the cost, coverage, and network details presented. Option B. Encouraging the beneficiary to call the customer service number of a specific Medicare Advantage plan that has been highly advertised, without demonstrating how to use the Plan Finder. Option C. Offering to complete the Medicare Plan Finder application on behalf of the beneficiary, inputting information based on general assumptions about their healthcare needs. Option D. Providing the beneficiary with a pre-selected list of the top 3 Medicare Advantage plans in their area based on perceived value, without requiring them to use the Plan Finder. The correct answer is A. Guiding the beneficiary to input their specific Medicare number and prescription drug list into the Medicare Plan Finder to generate personalized plan comparisons, and then explaining how to interpret the cost, coverage, and network details presented. Explanation. This scenario is professionally challenging because it requires a Medicare beneficiary to navigate complex plan options using a tool designed to simplify the process, which can be misinterpreted or misused if not understood thoroughly. The challenge lies in ensuring the beneficiary makes an informed decision that aligns with their specific healthcare needs and financial situation, while adhering to Medicare's regulatory framework for plan selection. Careful judgment is required to guide the beneficiary without overstepping professional boundaries or providing advice that could be construed as steering. The correct approach involves empowering the beneficiary to use the Medicare Plan Finder tool independently, providing them with the necessary information and context to interpret the results accurately. This approach respects the beneficiary's autonomy and aligns with Medicare's emphasis on beneficiary education and informed choice. Specifically, guiding the beneficiary to input accurate personal health information, understand the different plan types, e.g., Original Medicare, Medicare Advantage, prescription drug plans, and compare costs, coverage, and provider networks using the Plan Finder is crucial. This aligns with the Centers for Medicare and Medicaid Services, CMS, guidelines that encourage beneficiaries to utilize available resources for plan comparison. An incorrect approach would be to directly recommend a specific plan without a thorough, documented assessment of the beneficiary's needs, and without allowing them to explore options themselves. This could lead to a violation of CMS rules against steering beneficiaries towards particular plans, potentially based on undisclosed incentives or incomplete information. Another incorrect approach would be to simply provide a list of plans without explaining how to use the Plan Finder or how to interpret the information presented, failing to adequately educate the beneficiary and hindering their ability to make an informed decision. This neglects the educational component of Medicare beneficiary support. Finally, focusing solely on the lowest premium without considering the total cost of care, deductibles, copayments, coinsurance, or the adequacy of the network and drug formulary would be a failure to provide comprehensive guidance, potentially leading to unexpected out-of-pocket expenses for the beneficiary. The professional decision-making process for similar situations should involve a thorough understanding of Medicare regulations regarding beneficiary counseling and plan selection. Professionals should prioritize beneficiary education, empowering them to use resources like the Medicare Plan Finder effectively. This includes explaining the tool's functionalities, the types of information it provides, and the importance of considering all relevant factors, cost, coverage, network, formulary, in relation to their individual healthcare needs. The focus should always be on facilitating informed choice, not on making the choice for the beneficiary. Question 4. During the evaluation of a Medicare Advantage organization's marketing materials intended for distribution during the Medicare Advantage Open Enrollment Period, MAOP, which of the following approaches best reflects a compliant understanding of beneficiary enrollment rights and MAO responsibilities? Option A. Materials inform beneficiaries that they can switch from Original Medicare to a Medicare Advantage plan during the MAOEP. Option B. The materials highlight that beneficiaries can switch from their current Medicare Advantage plan to another Medicare Advantage plan, but do not mention the option to return to Original Medicare. Option C. The materials suggest that beneficiaries can enroll in a new Medicare Advantage plan at any time during the MAOEP, regardless of their current coverage status, Option D. The materials accurately state that beneficiaries can switch from their current Medicare Advantage plan to another Medicare Advantage plan, or disenroll from a Medicare Advantage plan to return to original Medicare. Correct answer is D. The materials accurately state that beneficiaries can switch from their current Medicare Advantage plan to another Medicare Advantage plan, or disenroll from a Medicare Advantage plan to return to original Medicare. Explanation: this scenario presents a professional challenge because it requires a nuanced understanding of Medicare Advantage open enrollment period (MAOP) rules, specifically concerning the types of plan changes permitted and the communication strategies employed by Medicare Advantage organizations (MAO). Misinterpreting these rules can lead to improper enrollment practices, potentially harming beneficiaries and resulting in regulatory penalties for the MAO. Careful judgment is required to ensure compliance and protect beneficiary rights. The correct approach involves accurately identifying that during the MAOEP, beneficiaries can switch from one Medicare Advantage plan to another Medicare Advantage plan, or from a Medicare Advantage plan to original Medicare. It also allows for disenrollment from a Medicare Advantage plan to return to original Medicare, with or without a prescription drug plan. This approach correctly recognizes the scope of permissible changes and avoids misrepresenting the enrollment options. An incorrect approach would be to communicate that beneficiaries can only switch to a different Medicare Advantage plan, thereby omitting the option to return to original Medicare. This failure constitutes a misrepresentation of available choices, potentially limiting a beneficiary's ability to make the best decision for their healthcare needs, and violating CMS guidelines on accurate enrollment information. Another incorrect approach would be to suggest that beneficiaries can enroll in a new Medicare Advantage plan at any time outside of the defined enrollment periods, without acknowledging the specific limitations of the MAOEP. This is a direct violation of enrollment period regulations and could lead to beneficiaries being enrolled in plans inappropriately. A further incorrect approach would be to advise beneficiaries that they can switch from original Medicare to a Medicare Advantage plan during the MAOEP, when in fact, this specific transition is typically handled during the annual election period (EAP) or a special enrollment period (SEP), not the MAOEP. This misstatement of enrollment eligibility creates confusion and can lead to improper enrollments. The professional decision-making process for similar situations should involve a thorough review of current CMS guidance and regulations pertaining to Medicare Advantage enrollment periods. When communicating with beneficiaries, it is crucial to provide clear, accurate, and comprehensive information about all available enrollment options and their associated timeframes. If there is any uncertainty, seeking clarification from CMS or legal counsel is paramount before disseminating information. The focus must always be on empowering beneficiaries with accurate knowledge to make informed healthcare coverage decisions. Question 5. The evaluation methodology shows that a Medicare-certified provider is considering offering a new specialized diagnostic service that is not explicitly listed in their current scope of certification. The provider has the necessary equipment and qualified staff to perform this service. Which of the following actions best aligns with Medicare certification requirements regarding limitations on services? Option A. Immediately begin offering the new diagnostic service, assuming it is implicitly covered as long as the provider has the capability and the service is medically necessary. Option B. Rely on general industry standards for diagnostic services to determine coverage and billing procedures for the new service. Option C. Offer the new diagnostic service on a self-pay basis initially until Medicare coverage is clarified to avoid potential compliance issues. Option D. Conduct a comprehensive review of the Medicare Benefit Policy Manual and relevant CMS transmittals to determine if the new diagnostic service falls within the provider's existing certification scope or requires a modification to their certification. The correct answer is A. Immediately begin offering the new diagnostic service, assuming it is implicitly covered as long as the provider has the capability and the service is medically necessary. Explanation: this scenario is professionally challenging because it requires a nuanced understanding of Medicare certification limitations, specifically concerning the scope of services a provider can offer and the documentation necessary to support those services. The challenge lies in balancing the desire to expand service offerings to meet patient needs with the strict regulatory boundaries set by Medicare. Accurate interpretation and application of these limitations are crucial to avoid compliance issues, financial penalties, and potential loss of certification. The correct approach involves a thorough review of the Medicare certification guidelines to identify specific limitations related to the proposed new services. This includes understanding what constitutes a covered service, any pre-authorization requirements, and the documentation standards for billing. By meticulously cross-referencing the proposed services against the Medicare Benefit Policy Manual and other relevant CMS guidance, the provider can accurately determine if the services fall within the scope of their current certification or if additional certification or modifications are required. This proactive, evidence-based approach ensures compliance and avoids potential pitfalls. An incorrect approach would be to assume that any service a provider is capable of offering is automatically covered by Medicare. This overlooks the specific definitions and limitations within Medicare law. Another incorrect approach is to proceed with offering new services without consulting the relevant Medicare guidelines, relying instead on general industry practices or the advice of non-Medicare-specific consultants. This demonstrates a failure to adhere to the specific regulatory framework governing Medicare certification and could lead to improper billing and noncompliance. Finally, an approach that prioritizes revenue generation over strict adherence to Medicare limitations is fundamentally flawed, as it prioritizes financial gain over legal and ethical obligations, risking severe repercussions. Professionals should approach such situations by prioritizing regulatory compliance. This involves a systematic process of 1. Identifying the proposed change or service. 2. Consulting the definitive Medicare regulatory framework, e.g., the Medicare Benefit Policy Manual, Code of Federal Regulations, for relevant guidelines and limitations. 3. Documenting the findings and the rationale for any decision. 4. Seeking clarification from official Medicare resources or legal counsel if ambiguity exists. 5. Implementing services only after confirming compliance and ensuring all necessary documentation and certification requirements are met. Question 6. Operational review demonstrates that a skilled nursing facility, SNF, is experiencing delays in resident admissions and discharge planning due to perceived inefficiencies in their current documentation and communication protocols. To address this, the SNF is considering implementing a new electronic health record (EHR) system that promises faster data entry and improved interdepartmental communication, alongside a revised staffing model that reallocates certain administrative tasks to direct care staff to expedite paperwork. Which approach to process optimization best aligns with Medicare certification requirements for SNFs? Option A. Reallocate administrative tasks to direct care staff to expedite paperwork, focusing on reducing the overall time spent on documentation, and defer a comprehensive review of the EHR system's regulatory implications until after its initial rollout. Option B. Implement the new EHR system and revise staffing model after a thorough assessment of how these changes impact compliance with Medicare's conditions of participation for SNFs, ensuring all required documentation elements are captured, and that staff roles remain within their scope of practice and regulatory guidelines. Option C. Focus on streamlining the admission and discharge processes by reducing the number of required assessments and consultations to speed up patient throughput, as this will improve facility efficiency and patient satisfaction. Option D. Prioritize the implementation of the new EHR system solely based on its potential for speed and efficiency, assuming that faster processes will inherently lead to better patient care and compliance. The correct answer is B. Implement the new EHR system and revise staffing model after a thorough assessment of how these changes impact compliance with Medicare's conditions of participation for SNFs, ensuring all required documentation elements are captured, and that staff roles remain within their scope of practice and regulatory guidelines. Explanation. This scenario presents a professional challenge because optimizing skilled nursing facility (SNF) care processes requires balancing efficiency with the stringent regulatory requirements of Medicare certification. SNFs must adhere to specific standards for patient care, documentation, and facility operations to maintain their certification and reimbursement. Failure to align process improvements with these regulations can lead to deficiencies, loss of certification, and financial penalties. Careful judgment is required to identify improvements that enhance patient outcomes and operational flow without compromising compliance. Correct approach involves systematically evaluating current SNF care processes against Medicare's conditions of participation, (COPS), for SNFs, particularly those related to resident rights, quality of life, and provision of services. This includes assessing documentation practices for accuracy and completeness, ensuring staff training aligns with regulatory mandates, and verifying that care plans are individualized and consistently implemented. The justification for this approach lies in its direct alignment with the core principles of Medicare certification, which prioritize patient safety, quality of care, and adherence to federal standards. By focusing on regulatory compliance as the foundation for process optimization, SNFs can ensure that any changes made will sustain or improve their certification status. An incorrect approach would be to prioritize cost reduction or speed of service delivery, without a thorough review of Medicare regulations. For instance, implementing a new documentation system that reduces the time spent by staff, but omits critical data points required by Medicare would be a regulatory failure. Similarly, streamlining resident admission processes by bypassing necessary assessments or consultations would violate regulations concerning resident rights and the provision of appropriate care. Another incorrect approach would be to adopt new technologies or workflows based solely on industry best practices, without verifying their compatibility with Medicare's specific requirements for SNFs, potentially leading to noncompliance in areas such as infection control, medication management, or discharge planning. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the relevant Medicare COPS for SNFs. When considering process optimization, the initial step should always be to identify potential impacts on regulatory compliance. This involves a risk assessment where proposed changes are evaluated against specific regulatory requirements. If a proposed change appears to conflict with or inadequately address a regulatory mandate, it should be revised or rejected. Furthermore, ongoing monitoring and auditing of implemented processes are crucial to ensure sustained compliance and to identify any emergent issues that may require further adjustment. This proactive and compliance-centric approach ensures that operational improvements contribute to, rather than detract from, the SNF's ability to meet Medicare certification standards. Question 7. Comparative studies suggest that healthcare providers often face challenges in optimizing their revenue cycle management by accurately determining Medicare's role as a primary or secondary payer. When a Medicare beneficiary also has coverage through a large group health plan, what is the most compliant and efficient process for a provider to follow to ensure correct billing and avoid potential penalties? Option A. Proactively verify the beneficiary's other insurance coverage, including the large group health plan, at the time of service and coordinate benefits accordingly, billing the primary payer first. Option B. Bill Medicare as the primary payer and await a denial or request for coordination of benefits from Medicare. Option C. Submit claims to both Medicare and the large group health plan simultaneously and allow them to coordinate benefits. Option D. Bill the large group health plan as the primary payer without verifying Medicare status, assuming it will be secondary. The correct answer is B. Bill Medicare as the primary payer and await a denial or request for coordination of benefits from Medicare. Explanation. This scenario is professionally challenging because accurately determining Medicare's primary or secondary payer status is crucial for correct billing, preventing fraud and abuse, and ensuring beneficiaries receive appropriate coverage without undue financial burden. Misidentification can lead to claim denials, overpayments, and significant compliance risks for providers. Careful judgment is required to navigate the complex rules governing payer coordination. The correct approach involves a thorough review of the beneficiary's insurance information at the point of service to identify all other potential coverage. This includes inquiring about employer-sponsored group health plans, other Medicare plans, like Medicare Advantage, Medicaid, and any other insurance the beneficiary may have. This proactive identification allows for accurate coordination of benefits, ensuring Medicare pays only its correct secondary share when applicable, as mandated by Medicare Secondary Payer, MSP, regulations. Adhering to MSP rules is a fundamental compliance requirement for all Medicare providers. An incorrect approach of assuming Medicare is always the primary payer, without verifying other coverage, directly violates MSP regulations. This can lead to improper billing and potential recoupment of funds by Medicare. Another incorrect approach of delaying the verification of other insurance until after claims have been submitted and denied creates administrative inefficiencies and increases the risk of noncompliance, as it suggests a lack of due diligence in identifying primary payers upfront. Furthermore, relying solely on the beneficiary's self-report without independent verification, especially for complex insurance situations, can be unreliable and lead to errors in payer determination, thus failing to meet the standard of care for accurate billing. Professionals should employ a systematic process for payer identification. This involves training staff on MSB rules, implementing robust front-end processes for collecting and verifying insurance information, utilizing payer verification tools, and establishing clear protocols for handling situations where multiple payers are involved. The decision-making process should prioritize regulatory compliance and accurate financial stewardship. Question 8. The monitoring system demonstrates that a Medicare beneficiary has filed a grievance regarding a denial of coverage for a durable medical equipment (DME) item. The organization's internal review confirms the denial was based on a policy interpretation. What is the most appropriate next step to ensure compliance with Medicare certification requirements regarding grievance and appeals processes? Option A. Inform the beneficiary that the internal review upheld the denial and offer to reevaluate the case if new clinical information is provided, without mentioning external appeal rights. Option B. Provide the beneficiary with clear, written instructions on how to initiate a formal Medicare appeal, including information on deadlines and the appropriate level of appeal, while also documenting the internal grievance process. Option C. Advise the beneficiary to seek legal counsel to understand their options, as the organization cannot provide guidance on external appeal processes. Option D. Close the grievance file after the internal review is complete, assuming the beneficiary will pursue external appeals if they choose to do so. The correct answer is A. Inform the beneficiary that the internal review upheld the denial and offer to reevaluate the case if new clinical information is provided, without mentioning external appeal rights. Explanation. This scenario is professionally challenging because it requires balancing the need for efficient grievance resolution with the absolute imperative of adhering to Medicare's strict regulatory framework for beneficiary appeals. Failure to properly document and process appeals can lead to significant compliance issues, financial penalties, and erosion of beneficiary trust. Careful judgment is required to ensure that all procedural steps are followed meticulously, as mandated by Medicare guidelines, to protect beneficiary rights. The correct approach involves a systematic review of the grievance, identification of the specific appeal, rights applicable under Medicare regulations, and the provision of clear, actionable instructions to the beneficiary on how to proceed with their appeal. This ensures that the beneficiary's right to a fair and timely appeal is upheld, and that the organization remains in compliance with 42 CFR Part 405, Subpart I, which governs Medicare appeals. This approach prioritizes beneficiary rights and regulatory adherence. An incorrect approach that focuses solely on internal resolution without clearly informing the beneficiary of their Medicare appeal rights fails to meet regulatory requirements. Medicare beneficiaries have a statutory right to appeal adverse coverage decisions, and the organization has a responsibility to facilitate this process, not circumvent it. Another incorrect approach that provides vague or incomplete information about the appeal process can mislead the beneficiary and hinder their ability to exercise their rights, potentially violating due process principles and specific Medicare appeal regulations. Finally, an approach that delays or obstructs the appeal process, even unintentionally, can lead to sanctions and a loss of Medicare certification. Professionals should employ a decision-making framework that begins with a thorough understanding of the beneficiary's grievance and the specific Medicare regulations governing appeals. This involves identifying the type of decision being appealed, the applicable timeframes, and the required documentation. The next step is to clearly communicate the beneficiary's appeal rights and the procedural steps involved, ensuring all information is accurate and compliant with Medicare guidelines. If the organization has an internal grievance process, it should run concurrently with, or be clearly distinguished from, the formal Medicare appeal process, ensuring the beneficiary is not misled about their rights. Continuous training on Medicare appeal procedures and regular audits of grievance and appeal handling are crucial to maintain compliance and protect beneficiary interests. Question 9. Investigation of a Medicare Advantage sales agent's interaction with a potential enrollee reveals that the agent, in an effort to secure a sale, did not fully explain the specific enrollment period limitations for the plan being discussed, implying that enrollment could occur at any time. Which of the following approaches best reflects the required adherence to Medicare sales and enrollment regulations as per AHIP guidelines? Option A. The agent should have clearly explained the applicable enrollment periods, including any deadlines, and the consequences of missing those deadlines, ensuring the beneficiary understood when enrollment was permissible. Option B. The agent should have emphasized that enrollment is always possible for Medicare beneficiaries, regardless of the specific plan or time of year. Option C. The agent should have focused on the plan's benefits and downplayed the importance of enrollment timing to encourage immediate enrollment. Option D. The agent should have provided a general overview of Medicare enrollment without detailing specific plan period limitations, assuming the beneficiary would inquire further if needed. Correct answer is A. The agent should have clearly explained the applicable enrollment periods, including any deadlines, and the consequences of missing those deadlines, ensuring the beneficiary understood when enrollment was permissible. Explanation. This scenario is professionally challenging because it requires a sales agent to balance the imperative of securing enrollment with the absolute necessity of adhering to Medicare's strict marketing and enrollment regulations. Misrepresenting plan benefits or enrollment procedures can lead to significant penalties for the agent and the organization, as well as harm to beneficiaries who may enroll in plans that do not meet their needs. Careful judgment is required to ensure all communications are accurate, transparent, and compliant with AHIP guidelines for Medicare Advantage and Part D plans. The correct approach involves clearly and accurately explaining the enrollment process, including any deadlines, required documentation, and the implications of enrollment, such as changes to existing coverage. This approach prioritizes beneficiary understanding and informed decision-making, which is a core ethical and regulatory requirement. Specifically, Medicare Advantage and Part D marketing guidelines, as overseen by AHIP for its certified agents, mandate that agents provide accurate information about plan benefits, costs, and enrollment procedures. Transparency about any limitations or exclusions is also crucial. This approach ensures that beneficiaries are not misled and can make choices that align with their healthcare needs and financial situations, thereby upholding the integrity of the Medicare program and the agent's professional responsibilities. An incorrect approach that involves downplaying or omitting information about enrollment deadlines creates a significant regulatory failure. Medicare has specific enrollment periods, e.g., annual election period, special enrollment periods, with strict deadlines. Failing to inform a beneficiary about these deadlines can lead to them missing the opportunity to enroll or disenroll, potentially causing them to remain in a plan that is not suitable or to be unable to access needed coverage. This violates the principle of providing accurate and complete information. Another incorrect approach, such as exaggerating the benefits of a particular plan or making guarantees about coverage that are not supported by the plan documents, constitutes a misrepresentation. Medicare marketing rules strictly prohibit misleading statements or omissions that could influence a beneficiary's enrollment decision. Such actions can lead to fines, sanctions, and loss of certification for the agent. Beneficiaries rely on accurate information to make critical healthcare decisions, and misrepresentation erodes trust and can result in financial harm or inadequate healthcare access. A further incorrect approach, such as pressuring a beneficiary to enroll immediately without allowing them adequate time to consider the information or ask questions, violates the spirit and letter of Medicare's beneficiary protection regulations. Agents are expected to facilitate informed consent, not to coerce enrollment. This pressure tactic can lead to beneficiaries making rushed decisions they later regret, and it demonstrates a disregard for the beneficiary's autonomy and well-being. The professional decision-making process for similar situations should involve a commitment to understanding and applying all relevant Medicare marketing and enrollment guidelines. Before engaging with a potential enrollee, agents should review the plan benefits and enrollment procedures thoroughly. During interactions, they must prioritize clear, accurate, and complete communication, ensuring that beneficiaries have ample opportunity to ask questions and understand all aspects of the plan and the enrollment process. If there is any doubt about the accuracy or compliance of a statement or action, the agent should err on the side of caution and seek clarification from their compliance department or supervisory personnel. The ultimate goal is to facilitate informed enrollment that benefits the beneficiary and upholds regulatory standards. Question 10. Strategic planning requires a healthcare provider to accurately assess a patient's eligibility for Medicare's qualifying individual QI program. Given a patient presents with a stated income that appears close to the QI program's upper limit, which of the following actions best aligns with Medicare's regulatory framework for determining QI eligibility? Option A. Requesting and meticulously reviewing the patient's most recent tax returns, pay stubs, and any other official documentation that substantiates their reported income and assets to compare against the current year's QI income and asset limits. Option B. Accepting the patient's verbal confirmation of their income and asset levels, assuming they are accurately reporting their financial situation. Option C. Informing the patient that their income level likely disqualifies them from the QI program based on a general understanding of Medicare's income thresholds. Option D. Advising the patient that their current health status and need for medical services are the primary factors for QI program eligibility. The correct answer is A. Requesting and meticulously reviewing the patient's most recent tax returns, pay stubs, and any other official documentation that substantiates their reported income and assets to compare against the current year's QI income and asset limits. Explanation. This scenario is professionally challenging because it requires a healthcare provider to navigate the complex eligibility requirements for the qualifying individual QI program under Medicare, balancing patient needs with strict regulatory adherence. The provider must understand the nuances of income and asset limitations, as well as the specific documentation required by Medicare to ensure accurate enrollment and prevent potential financial penalties or patient dissatisfaction. Careful judgment is needed to assess a patient's situation against these criteria without overstepping boundaries or providing misleading information. The correct approach involves a thorough review of the patient's financial documentation against the current year's established income and asset limits for the QI program, as defined by Medicare regulations. This approach is right because it directly aligns with the absolute priority of adhering to Medicare's specific eligibility criteria. By meticulously verifying the patient's financial status against these defined limits, the provider ensures compliance with federal law and the program's intent to assist low-income Medicare beneficiaries. This systematic verification prevents incorrect enrollment and upholds the integrity of the Medicare program. An incorrect approach would be to rely solely on the patient's verbal assertion of their financial situation without independent verification. This fails to meet the regulatory requirement for documented proof of income and assets, which is essential for Medicare eligibility determination. It risks enrolling ineligible individuals, leading to program misuse and potential recoupment of funds by Medicare. Another incorrect approach would be to assume eligibility based on the patient's general health status or perceived need for assistance. Medicare's QI program is strictly income and asset-based, and a patient's health condition, while important for Medicare Part A and B coverage, is not a determinant for QI eligibility. This approach disregards the specific financial criteria mandated by law. A further incorrect approach would be to provide the patient with a definitive statement of eligibility before completing a full review of all required documentation. This constitutes providing potentially inaccurate information, which can lead to false expectations and create a difficult situation if the patient is later found ineligible. It also bypasses the necessary due diligence required by Medicare. Professionals should employ a decision-making framework that prioritizes regulatory compliance and accurate information dissemination. This involves 1. Understanding the specific program requirements, QI eligibility criteria. 2. Gathering all necessary documentation as outlined by Medicare. 3. Meticulously comparing the gathered information against the established regulatory limits. 4. Communicating clearly and accurately with the patient about the process and potential outcomes, avoiding definitive statements until all verification is complete. 5. Seeking clarification from official Medicare resources or supervisors when eligibility is unclear. Question 11. The risk matrix shows a potential for claim denials related to Medicare Part A coverage for extended stays in skilled nursing facilities. A beneficiary has been in a SNF for 75 consecutive days, receiving assistance with bathing, dressing, and medication reminders, but also undergoing daily physical therapy prescribed by their physician to regain mobility after a hip fracture. Which approach best aligns with Medicare Part A coverage requirements for this scenario? Option A. The entire stay is likely covered by Medicare Part as long as the beneficiary remains in a SNF and the benefit period has not ended. Option B. Medicare Part A may cover the physical therapy as a skilled service, but the assistance with daily living activities is considered custodial care and not covered. Option C. Medicare Part A covers all services provided in a SNF, including custodial care, as long as the beneficiary is admitted by a physician. Option D. Medicare Part A coverage is limited to the first 60 days of the benefit period, regardless of the services provided. The correct answer is A. The entire stay is likely covered by Medicare Part as long as the beneficiary remains in a SNF and the benefit period has not ended. Explanation. This scenario presents a professional challenge because it requires distinguishing between services that are considered medically necessary and covered under Medicare Part A, and those that are not, which can have significant financial implications for both the beneficiary and the healthcare provider. The core of the challenge lies in interpreting the nuances of Medicare's coverage rules, particularly concerning the benefit period and the definition of inpatient care versus custodial care. Careful judgment is required to ensure accurate billing and to avoid potential fraud or abuse allegations. The correct approach involves a thorough understanding of Medicare Part A's benefit period rules and the distinction between skilled nursing care and custodial care. Medicare Part A covers medically necessary inpatient hospital services, skilled nursing facility, SNF services, under specific conditions, hospice care, and some home health care. A benefit period begins the day a beneficiary is admitted as an inpatient in a hospital or SNF and ends when the beneficiary has not received inpatient hospital or SNF care for 60 consecutive days. Crucially, Medicare Part A does not cover custodial care, which is care that helps an individual with daily living activities like bathing, dressing, eating, but does not require skilled medical services. Therefore, correctly identifying whether a patient's needs are primarily for skilled care or custodial care is paramount. An incorrect approach would be to assume all care provided in a hospital or SNF setting is automatically covered by Medicare Part A. This fails to recognize that Medicare's coverage is contingent on medical necessity and the provision of skilled services. Another incorrect approach would be to focus solely on the duration of the stay without considering the nature of the services rendered. The benefit period is a mechanism for managing costs and coverage, but it does not override the fundamental requirement that the services themselves must be medically necessary and skilled. Furthermore, misclassifying custodial care as skilled care to secure Medicare reimbursement constitutes a violation of Medicare regulations and ethical standards, potentially leading to recoupment of payments, penalties, and reputational damage. The professional decision-making process for similar situations should involve a systematic review of the patient's medical record, physician's orders, and the services being provided. This review should be conducted by qualified personnel who understand Medicare coverage guidelines. When in doubt, consulting with Medicare administrative contractors or seeking expert advice on coverage determinations is a prudent step. The focus must always be on adherence to the specific regulations governing Medicare Part A coverage, ensuring that claims submitted accurately reflect the medical necessity and skilled nature of the services provided. Question 12. The review process indicates that a Medicare Advantage organization's outreach materials for its beneficiaries do not specifically address common healthcare-related scams, such as unsolicited offers for free medical equipment or requests for personal information over the phone by individuals claiming to be from Medicare. Which of the following approaches best aligns with Medicare certification requirements for beneficiary protection and education? Option A. Develop and distribute clear, concise educational materials that detail common Medicare scams, provide tips for identifying fraudulent activities, and direct beneficiaries to official reporting channels for suspected fraud. Option B. Provide beneficiaries with a list of all medical equipment suppliers with whom the plan has contracts, assuming this will deter unsolicited offers. Option C. Include a general disclaimer in all beneficiary communications, stating that the plan is not responsible for any fraudulent activities beneficiaries may encounter. Option D. Rely on the plan's general customer service representatives to answer any beneficiary questions related to potential scams as they arise. The correct answer is A. Develop and distribute clear, concise educational materials that detail common Medicare scams, provide tips for identifying fraudulent activities, and direct beneficiaries to official reporting channels for suspected fraud. Explanation. The review process indicates a potential vulnerability in how a Medicare Advantage plan is educating its beneficiaries about common scams. This scenario is professionally challenging because it requires a nuanced understanding of Medicare regulations concerning beneficiary communication and fraud prevention, balanced with the ethical imperative to protect vulnerable individuals. The plan must ensure its educational materials are not only informative, but also compliant with specific CMS guidelines, which are designed to prevent misinterpretation and exploitation. The correct approach involves proactively developing and disseminating clear, actionable guidance to beneficiaries on identifying and reporting common Medicare-related scams. This includes providing specific examples of fraudulent schemes, detailing how to verify information from providers or the plan, and outlining the official channels for reporting suspicious activity to Medicare and law enforcement. This approach is right because it directly addresses the regulatory requirement for Medicare Advantage organizations to protect their beneficiaries from fraud and abuse, as mandated by the Centers for Medicare and Medicaid Services, CMS. CMS expects plans to play an active role in educating beneficiaries about potential risks and empowering them to safeguard their personal information and healthcare benefits. This proactive stance aligns with the ethical duty of care owed to beneficiaries, particularly those who may be more susceptible to scams due to age or health status. An incorrect approach would be to assume that beneficiaries are already aware of common scams, or that the plan's general customer service is sufficient to address these issues. This fails to meet the regulatory expectation for targeted, specific education on fraud prevention. Another incorrect approach is to provide vague or overly technical information that is difficult for beneficiaries to understand or act upon. This not only fails to protect beneficiaries, but could also lead to frustration and a lack of trust in the plan. Furthermore, an approach that relies solely on beneficiaries reporting scams after they have occurred, without providing them with the tools and knowledge to prevent them, is insufficient and does not fulfill the plan's responsibility to proactively mitigate risk. Professionals should approach this situation by first consulting the latest CMS guidance on beneficiary education and fraud prevention. They should then develop educational materials that are simple, direct, and actionable, using plain language and visual aids where appropriate. Testing these materials with a sample group of beneficiaries can help ensure clarity and effectiveness. Finally, establishing clear communication channels for reporting suspected fraud and ensuring prompt follow-up are crucial components of a robust beneficiary protection program. Question 13. The control framework reveals that a Medicare Advantage organization, MAO, is reviewing its member engagement strategies for preventive care. The MAO is considering implementing a program that automatically reimburses members for any screening tests or vaccinations they receive from any provider, regardless of whether the service is explicitly covered by Medicare Part B or if the provider is enrolled in Medicare. Which of the following approaches best aligns with Medicare certification requirements for MAOs regarding screenings and vaccinations? Option A. The MAO automatically reimburses members for all screening tests and vaccinations presented, assuming the services are beneficial for preventive health, to encourage maximum utilization. Option B. The MAO encourages providers to bill for a broader range of screening and vaccination codes than typically covered by Medicare, suggesting that these expanded services are necessary for comprehensive preventive care. Option C. The MAO prioritizes reimbursement for screenings and vaccinations that contribute to its internal quality metrics, potentially limiting coverage for other Medicare-approved preventive services if they do not align with these metrics. Option D. The MAO establishes a clear communication channel with its members and contracted providers to educate them on Medicare-covered preventive services, their eligibility criteria, and the importance of receiving these services from Medicare-enrolled providers, ensuring all claims are processed according to Medicare's coding, coverage, and payment rules. Correct answer is D. The MAO establishes a clear communication channel with its members and contracted providers to educate them on Medicare-covered preventive services, their eligibility criteria, and the importance of receiving these services from Medicare-enrolled providers, ensuring all claims are processed according to Medicare's coding, coverage, and payment rules. Explanation: this scenario is professionally challenging because it requires a Medicare Advantage organization, MAO, to balance the need to encourage preventive care, such as screenings and vaccinations, with the absolute priority of adhering to Medicare's regulatory framework for coverage and payment. MAOs must ensure that all services provided to beneficiaries are medically necessary, appropriately documented, and billed in accordance with Medicare guidelines to avoid fraud, waste, and abuse. The pressure to meet performance metrics or quality scores can inadvertently lead to practices that deviate from these strict requirements. The correct approach involves the MAO ensuring that its members are informed about the availability of Medicare-covered preventive services, including screenings and vaccinations, and that these services are provided by eligible providers and billed according to Medicare's specific coding and payment rules. This means the MAO must have robust internal controls to verify that 1. The services are indeed covered preventive services under Medicare Part B. 2. The beneficiary meets any specific eligibility criteria, e.g., age risk factors. 3. The service is rendered by a qualified provider. And 4. The claim submitted accurately reflects the service provided and adheres to all documentation requirements. This aligns with the MAO's responsibility to manage its Medicare contract effectively and ethically, ensuring beneficiaries receive appropriate care while maintaining compliance with federal regulations. An incorrect approach would be to automatically cover or reimburse for all screenings and vaccinations presented by members without verifying their Medicare coverage status or adherence to specific Medicare guidelines. This could lead to payment for non-covered services, services not medically necessary for the individual, or services rendered by non-qualified providers, all of which violate Medicare regulations. Another incorrect approach would be to restrict access to medically necessary preventive services solely based on the MAO's internal quality metrics or cost containment goals, if those restrictions go beyond Medicare's defined coverage criteria. This could deny beneficiaries access to services they are entitled to under Medicare, potentially leading to adverse health outcomes and regulatory noncompliance. Finally, an incorrect approach would be to encourage providers to bill for services that were not rendered or to upcode services to maximize reimbursement, even if the services are legitimate preventive measures. This constitutes fraudulent billing practices and is a direct violation of Medicare's anti-fraud provisions. Professionals should employ a decision-making framework that prioritizes regulatory compliance above all else when managing Medicare benefits. This involves a thorough understanding of the Medicare Coverage Database, MCD, National Coverage Determinations, NCD, and Local Coverage Determinations, LCD. When in doubt about coverage or billing, seeking clarification from the Centers for Medicare and Medicaid Services, CMS, or its contractors is essential. Furthermore, implementing strong internal audit and compliance programs to regularly review claims and provider practices is crucial to proactively identify and correct any potential issues before they escalate into significant regulatory violations. Question 14. Assessment of how a Medicare Advantage plan representative should explain the impact of low-income subsidy, extra help, on prescription drug cost-sharing for a beneficiary enrolled in a Part D plan with extra help, considering the beneficiary's specific LIS level and the plan's formulary. Option A. Advise the beneficiary to contact the Social Security Administration directly for all information regarding their extra help benefits and how they apply to their current Medicare Advantage plan. Option B. Describe the plan's standard formulary and cost-sharing tiers as if the beneficiary were not receiving any extra help, and then briefly mention that extra help might offer some savings. Option C. Provide a general explanation of Medicare Part D cost-sharing structures and the typical coverage gap, without confirming the beneficiary's extra help status or its specific impact on their plan. Option D. Accurately explain the beneficiary's specific copayment or coinsurance amounts for covered drugs based on their confirmed extra help level and the plan's formulary, detailing how extra help modifies standard cost sharing and impacts any coverage gap benefits. The correct answer is D. Accurately explain the beneficiary's specific copayment or coinsurance amounts for covered drugs based on their confirmed extra help level and the plan's formulary, detailing how extra help modifies standard cost sharing and impacts any coverage gap benefits. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of Medicare Advantage, MA plan benefits and cost-sharing structures, specifically concerning extra help, low-income subsidy, eligibility. A Medicare beneficiary's ability to access essential prescription drugs at reduced out-of-pocket costs hinges on accurate information about their plan's benefits and how extra help interacts with those benefits. Misinformation can lead to significant financial hardship and barriers to care. The correct approach involves accurately assessing the beneficiary's current extra help status and explaining how it directly impacts their cost-sharing obligations within their specific Medicare Advantage plan. This means verifying the beneficiary's LIS level and then detailing the corresponding copayment or coinsurance amounts for covered drugs, as well as any applicable coverage gap. Donut hole benefits for those receiving extra help. This approach is correct because it directly addresses the beneficiary's concern by providing precise, actionable information grounded in Medicare regulations and the specifics of their plan and extra help status. It prioritizes clarity, accuracy, and the beneficiary's financial well-being, aligning with the ethical obligation to provide comprehensive and understandable guidance. An incorrect approach would be to provide a general overview of Medicare Part D cost-sharing without confirming the beneficiary's extra help status. This fails to acknowledge the significant impact of extra help on reducing out-of-pocket expenses and can lead the beneficiary to believe their costs will be higher than they actually are, potentially causing undue stress or discouraging them from filling prescriptions. Another incorrect approach would be to solely focus on the plan's standard formulary and cost-sharing tiers without integrating the extra help provisions. This overlooks the critical regulatory framework that modifies cost-sharing for low-income beneficiaries, leading to an incomplete and misleading picture of their financial responsibility. A third incorrect approach would be to advise the beneficiary to contact Social Security Administration without first providing them with the information they can readily understand about how extra help applies to their current plan. While SSA is the administrator of extra help, the MA plan representative has a responsibility to explain the benefits and cost-sharing reductions as they apply to the plan itself. The professional decision-making process for similar situations should involve 1. Actively listening to the beneficiary's specific concern, identifying the core issue, cost-sharing and extra help. 2. Accessing and verifying the beneficiary's relevant information, plan enrollment, extra help status and level. 3. Clearly explaining how the beneficiary's specific extra help level modifies the standard cost-sharing for their Medicare Advantage plan, referencing covered drugs and any applicable coverage gap provisions. 4. Providing clear, understandable language, avoiding jargon, and offering opportunities for further questions. Question 15. Upon reviewing a Medicare Advantage PPO member's request for an elective surgical procedure with a highly specialized surgeon who is not in the plan's network, and receiving documentation from the member's primary care physician strongly recommending this specific surgeon due to their unique expertise in a rare condition, what is the most appropriate course of action for the PPO case manager? Option A. Initiate the out-of-network authorization process, ensuring all necessary medical documentation is gathered and reviewed for medical necessity, and communicate the potential for member cost-sharing differences. Option B. Advise the member to delay the procedure until the PPO can attempt to contract with the out-of-network surgeon, which could take an extended period. Option C. Deny the request outright because the provider is not within the PPO's contracted network, advising the member to seek care from an in-network surgeon. Option D. Inform the member that out-of-network care is never covered by the PPO and suggest they pay the full cost of the procedure themselves. The correct answer is A. Initiate the out-of-network authorization process, ensuring all necessary medical documentation is gathered and reviewed for medical necessity, and communicate the potential for member cost-sharing differences. Explanation. This scenario presents a professional challenge because it requires balancing the financial interests of a preferred provider organization, PPO, with the ethical obligation to ensure beneficiaries receive appropriate and necessary care, even if it falls outside the PPO's contracted network. The core tension lies in the PPO's incentive to steer members towards in-network providers for cost savings versus the member's right to access care that may be best suited for their specific medical needs, regardless of network status. Careful judgment is required to navigate this conflict while adhering to Medicare regulations and ethical principles. The correct approach involves advocating for the beneficiary's medical needs by facilitating an out-of-network authorization when medically justified. This aligns with the ethical principle of patient advocacy and the regulatory expectation that Medicare Advantage plans, including PPOs, must ensure beneficiaries have access to medically necessary services. Specifically, Medicare Advantage organizations are required to have procedures in place for approving or denying coverage for services, including those rendered by out-of-network providers, based on medical necessity. Facilitating the authorization process, even for out-of-network care, demonstrates a commitment to the beneficiary's well-being and adherence to the spirit of Medicare coverage. An incorrect approach would be to rigidly deny the request solely based on the provider being out-of-network, without a thorough review of the medical necessity. This fails to uphold the beneficiary's right to access appropriate care and could violate Medicare Advantage regulations that mandate coverage for medically necessary services. Another incorrect approach would be to delay the authorization process excessively, which can negatively impact patient outcomes and is contrary to the timely provision of care expected under Medicare. Furthermore, pressuring the beneficiary to seek care from a less suitable in-network provider when a more appropriate out-of-network option exists would be an ethical breach, prioritizing the PPO's financial interest over the patient's health. Professionals should employ a decision-making framework that prioritizes patient well-being and regulatory compliance. This involves 1. Understanding the beneficiary's medical condition and the rationale for seeking out-of-network care. 2. Consulting relevant Medicare Advantage plan policies and procedures regarding out-of-network authorizations. 3. Collaborating with the treating physician to obtain documentation supporting medical necessity. 4. Advocating for the beneficiary by initiating the authorization process and ensuring a timely and fair review, even if it means approving out-of-network services. This process ensures that decisions are evidence-based, patient-centered, and compliant with Medicare regulations. Question 16. Process analysis reveals that a Medicare beneficiary, who is also a client of a financial advisor, is struggling to afford their Medicare Part B premiums and other healthcare costs. The client expresses a strong desire to enroll in a Medicare Savings Program, MSP, to alleviate these financial burdens. The client mentions that they recently received a small inheritance that, if counted, might push their countable income slightly above the threshold for the most beneficial MSP. The client asks the advisor if there's a way to manage this inheritance so they can qualify. What is the most ethically and regulatorily sound approach for the financial advisor to take in this situation? Option A. Advise the client to report all income and assets accurately to the state Medicaid agency and assist them in gathering the necessary documentation to determine their eligibility based on the reported information. Option B. Suggest the client delay reporting the inheritance until the next calendar year, hoping their income will be below the threshold then, or advise them to spend down the inheritance on non-essential items before reporting it. Option C. Inform the client that based on the mention of the inheritance, they are likely ineligible for any MSP and advise them to forego applying. Option D. Recommend the client transfer the inheritance to a trusted family member to reduce their countable assets and income, without thoroughly investigating the state's specific transfer of asset rules and look-back periods. The correct answer is A. Advise the client to report all income and assets accurately to the state Medicaid agency and assist them in gathering the necessary documentation to determine their eligibility based on the reported information. Explanation. This scenario presents a professional challenge because it requires balancing the fiduciary duty to a client with the ethical obligation to ensure accurate representation of eligibility for government programs. Misrepresenting a client's financial situation, even with the intention of securing benefits, can lead to serious consequences, including penalties for the client and the advisor, and can undermine the integrity of the Medicare savings programs. Careful judgment is required to navigate the complex eligibility rules and ensure that all information provided is truthful and verifiable. The correct approach involves diligently gathering all necessary financial documentation from the client and accurately reporting it to the state Medicaid agency, responsible for determining Medicare savings program eligibility. This approach upholds the principle of honesty and transparency, which are fundamental ethical requirements in financial advising, and are directly aligned with the regulatory framework governing Medicare savings programs. By providing accurate information, the advisor ensures the client receives benefits they are legitimately entitled to without engaging in fraudulent practices. An incorrect approach involves intentionally omitting or misrepresenting income or assets to make the client appear more eligible for a Medicare savings program. This constitutes a misrepresentation of facts to a government agency, which is a form of fraud. Such actions violate ethical standards of integrity and honesty, and can lead to severe penalties for both the client and the advisor, including disqualification from benefits, repayment of improperly received funds, and potential legal sanctions. Another incorrect approach is to advise the client to transfer assets to family members to reduce their countable assets below the eligibility threshold, without fully understanding the implications, or ensuring compliance with all state and federal guidelines for asset transfers. This can be considered a form of spend-down that may violate look-back periods or other transfer of asset rules, leading to ineligibility or penalties. It also fails to provide the client with complete information about the potential consequences of such actions. A further incorrect approach is to assume eligibility without a thorough review of the client's financial situation and the specific program requirements. This demonstrates a lack of due diligence and professional responsibility. Relying on assumptions rather than verified data can lead to incorrect advice and potentially harm the client by causing them to miss out on benefits they qualify for or to pursue benefits they are not eligible for, wasting valuable time and resources. A professional decision-making process for similar situations should involve a commitment to understanding the specific eligibility criteria for Medicare savings programs as defined by the Centers for Medicare and Medicaid Services, CMS, and the relevant state Medicaid agency. It requires a thorough and honest assessment of the client's financial circumstances, supported by verifiable documentation. When faced with complex situations, seeking clarification from the administering agency or consulting with legal counsel specializing in elder law or public benefits is a prudent step. The ultimate goal is to assist the client in accessing legitimate benefits through truthful and compliant means. Question 17. Performance analysis shows a Medicare Advantage HMO is reviewing a request for an experimental treatment for a member with a chronic, progressive illness. The treatment is not explicitly listed in the HMO's standard benefit package, but the member's physician believes it is the only viable option to potentially slow disease progression. The HMO must decide whether to approve or deny this request. Which of the following approaches best aligns with Medicare certification requirements for HMOs? Option A. Conduct a thorough review of the member's medical records and the requested treatment against Medicare coverage rules and evidence-based clinical guidelines to determine medical necessity. Option B. Approve the request without further review, as the member's physician deems it the only viable option. Option C. Deny the request because the treatment is not explicitly listed in the HMO's standard benefit package. Option D. Delay the decision indefinitely while the HMO seeks further clarification from the manufacturer of the experimental treatment. Correct answer is C. Deny the request because the treatment is not explicitly listed in the HMO's standard benefit package. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of how Medicare regulations, specifically those governing health maintenance organizations, HMO, impact member access to care and the financial viability of the plan. The core tension lies between ensuring members receive medically necessary services and managing the financial risks inherent in an HMO model, which relies on capitated payments. Careful judgment is required to balance these competing interests while adhering strictly to Medicare certification requirements. The correct approach involves a thorough review of the member's medical records and the specific services requested, comparing them against the HMO's evidence-based clinical guidelines and the Medicare coverage rules for the services in question. This approach prioritizes patient well-being and adherence to regulatory mandates by ensuring that denials are based on objective criteria and are consistent with Medicare's definition of medical necessity. It also aligns with the principles of responsible managed care, where the organization acts as a steward of Medicare funds while fulfilling its contractual obligations to beneficiaries. The regulatory justification stems from the Centers for Medicare and Medicaid Services, CMS, requirements for Medicare Advantage organizations, MAO, which include provisions for ensuring access to care, grievance procedures, and the definition of medical necessity. An incorrect approach would be to deny the request solely based on the fact that the service is not explicitly listed in the HMO's standard benefit package. This fails to acknowledge that Medicare coverage is determined by federal law and CMS guidance, not solely by an individual plan's benefit design. The regulatory failure here is a potential violation of the Medicare Advantage contract, which requires MAOs to provide all medically necessary services covered by Medicare. Another incorrect approach would be to approve the request without a thorough review of the medical necessity, simply because the member is experiencing symptoms. While empathy is important, Medicare certification requires that services be medically necessary and appropriate for the diagnosis and treatment of illness or injury. Approving services without this due diligence can lead to inappropriate utilization of resources and potential noncompliance with Medicare program integrity rules. A third incorrect approach would be to delay the decision indefinitely, citing the need for further internal review without a defined timeline or clear process for escalation. This can lead to a failure to meet Medicare's timeliness requirements for coverage decisions and can negatively impact the member's health outcomes, creating a breach of the organization's duty to beneficiaries. The professional decision-making process for similar situations should involve a systematic evaluation of the request against established criteria. Is the service medically necessary according to Medicare guidelines? Does the HMO's contract with Medicare cover this type of service? Are there any specific exclusions or limitations that apply? If a denial is contemplated, is there clear, documented evidence to support the denial based on medical necessity or non-coverage? This process ensures that decisions are objective, compliant, and in the best interest of the Medicare beneficiary. Question 18. Implementation of a Medicare enrollment process for a newly eligible beneficiary who recently lost employer-sponsored health insurance requires careful consideration of available enrollment periods. The beneficiary expresses concern about immediate coverage needs and asks if they must wait for their initial enrollment period. Option A. Advise the beneficiary that they must wait for their initial enrollment period to enroll in Medicare, as this is the standard enrollment timeline. Option B. Recommend that the beneficiary delay enrollment in Medicare altogether until they are closer to retirement age to avoid potential premium increases. Option C. Inform the beneficiary that losing employer-sponsored health insurance is a qualifying event for a special enrollment period, allowing them to enroll outside of their initial enrollment period without penalty. Option D. Suggest the beneficiary enroll in a Medicare Advantage plan immediately, regardless of their eligibility for other enrollment periods, to ensure coverage. The correct answer is A. Advise the beneficiary that they must wait for their initial enrollment period to enroll in Medicare, as this is the standard enrollment timeline. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of Medicare enrollment periods, specifically the distinction between the initial enrollment period (AHIP) and special enrollment periods (SEP). Misinterpreting these periods can lead to significant financial penalties for the beneficiary and administrative burdens for the provider. The core of the challenge lies in accurately assessing the beneficiary's eligibility for an SEP based on specific life events, rather than assuming they must wait for their IEP. The correct approach involves a thorough assessment of the beneficiary's circumstances to determine if they qualify for a special enrollment period. This is crucial because Medicare regulations, as outlined by the Centers for Medicare and Medicaid Services, CMS, provide specific exceptions to the standard enrollment timelines. For instance, losing other health coverage, moving, or experiencing other qualifying events can trigger an SEP, allowing enrollment outside the typical IEP without penalty. This approach upholds the principle of ensuring beneficiaries have access to necessary healthcare coverage when eligible, adhering to the spirit and letter of Medicare law. An incorrect approach would be to automatically defer the beneficiary to their initial enrollment period without exploring SEP eligibility. This fails to acknowledge the regulatory provisions designed to prevent individuals from being without coverage due to qualifying life events. Such a failure could result in the beneficiary incurring late enrollment penalties for Medicare Part B, which are permanent and increase the monthly premium. Another incorrect approach would be to incorrectly identify a qualifying event for an SEP, leading to premature enrollment or enrollment in the wrong plan. This demonstrates a lack of understanding of the specific criteria CMS outlines for each SEP, potentially causing enrollment errors and subsequent coverage gaps or incorrect premium assessments. Professionals should approach such situations by first understanding the beneficiary's current coverage status and recent life events. They should then consult official CMS guidance on Medicare enrollment periods, paying close attention to the detailed criteria for each SEP. If there is any ambiguity, seeking clarification from official Medicare resources or a knowledgeable supervisor is paramount. This systematic process ensures accurate guidance is provided, protecting the beneficiary from financial penalties and ensuring timely, appropriate Medicare coverage. Question 19. Which approach would be most effective in ensuring a Medicare Advantage plan upholds beneficiary rights regarding access to information about filing grievances and appeals? Option A. Providing a general overview of grievance and appeal rights in the summary of benefits, with detailed information only available upon specific written request. Option B. Proactively providing beneficiaries with clear, easily understandable materials detailing their grievance and appeal rights, along with accessible contact information and assistance for filing, and ensuring these materials are readily available through multiple channels. Option C. Training customer service representatives to subtly discourage beneficiaries from filing grievances or appeals by highlighting the potential time commitment and complexity of the process. Option D. Requiring beneficiaries to navigate a complex online portal with multiple login steps to find information on grievances and appeals, and only offering phone support during limited business hours. The correct answer is B. Proactively providing beneficiaries with clear, easily understandable materials detailing their grievance and appeal rights, along with accessible contact information and assistance for filing, and ensuring these materials are readily available through multiple channels. Explanation. This scenario presents a professional challenge because Medicare beneficiaries have specific rights that plans must uphold, and failure to do so can lead to significant compliance issues and harm to beneficiaries. The challenge lies in balancing efficient plan operations with the absolute imperative to protect and facilitate beneficiary access to their rights, particularly when dealing with complex or potentially contentious situations. Careful judgment is required to ensure that, while plans manage their resources and processes, they do not inadvertently or intentionally impede a beneficiary's ability to exercise their rights. The correct approach involves proactively educating beneficiaries about their rights and providing clear, accessible channels for them to exercise those rights, such as filing grievances or appeals. This aligns directly with the Centers for Medicare and Medicaid Services, CMS, regulations, which mandate that Medicare Advantage organizations, MAO, and prescription drug plans, PDP, inform beneficiaries of their appeal and grievance rights and provide assistance in filing them. This approach fosters transparency, empowers beneficiaries, and demonstrates a commitment to compliance and member satisfaction, thereby minimizing the risk of regulatory violations. An incorrect approach that involves delaying or making it difficult for beneficiaries to access information about their rights, such as requiring multiple phone calls or complex forms for basic inquiries, fails to meet the regulatory requirement for providing timely and accessible information. This can be interpreted as an attempt to discourage beneficiaries from exercising their rights, which is a direct violation of beneficiary protections. Another incorrect approach that involves providing incomplete or misleading information about appeal or grievance processes, or suggesting that certain issues are not appealable when they are, undermines the beneficiary's ability to seek redress. This not only violates specific CMS requirements for accurate information dissemination, but also erodes trust and can lead to beneficiaries being unfairly denied services or coverage. A further incorrect approach that involves discouraging beneficiaries from filing grievances or appeals, perhaps by emphasizing the burden of the process or suggesting it is unlikely to succeed, directly contravenes the spirit and letter of beneficiary rights regulation. Medicare beneficiaries have a right to a fair and impartial review of coverage decisions, and any action that impedes this right is a serious compliance failure. Professionals should approach these situations by prioritizing beneficiary rights as outlined in Medicare regulations. This involves a commitment to transparency, accessibility, and support. A decision-making framework should include 1. Understanding and internalizing all relevant CMS regulations regarding beneficiary rights, appeals, and grievances. 2. Developing clear, concise, and easily accessible communication materials for beneficiaries. 3. Training staff to be knowledgeable, helpful, and supportive when beneficiaries inquire about their rights. 4. Establishing robust and user-friendly processes for filing and managing grievances and appeals. 5. Regularly reviewing and updating processes to ensure ongoing compliance and alignment with beneficiary needs. Question 20. The analysis reveals that a Medicare Advantage plan is considering implementing a new tiered cost-sharing structure for prescription drugs. The proposed tiers are designed to incentivize the use of generic medications, Tier 1, preferred brand name medications, Tier 2, and non-preferred brand name medications, Tier 3. The plan aims to achieve this by setting significantly lower copayments for Tier 1 drugs, moderate copayments for Tier 2, and substantially higher copayments for Tier 3. Which of the following approaches best aligns with Medicare's regulatory framework for tiered cost-sharing? Option A. Implementing the tiered cost-sharing structure as proposed, ensuring that the copayments for each tier are clearly communicated to beneficiaries and that the overall out-of-pocket costs remain within Medicare's established limits for Part D plans. Option B. Creating a fourth tier for specialty medications that has a fixed dollar copayment, irrespective of the drug's actual cost, to simplify administration. Option C. Designing the tiers based on the wholesale acquisition cost of the drugs, with higher tiers assigned to drugs with the highest wholesale acquisition costs, regardless of their clinical necessity or availability of therapeutically equivalent alternatives. Option D. Setting the copayments for Tier 3, non-preferred brand name medications, at a level that is prohibitively expensive for the majority of beneficiaries, thereby strongly discouraging their use even when prescribed by a physician. The correct answer is A. Implementing the tiered cost-sharing structure as proposed, ensuring that the copayments for each tier are clearly communicated to beneficiaries and that the overall out-of-pocket costs remain within Medicare's established limits for Part D plans. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of Medicare's tiered cost-sharing regulations, specifically how they apply to different types of covered services, and the potential for unintended consequences on beneficiary access and affordability. The core challenge lies in balancing the goal of encouraging cost-effective care with the imperative to ensure that beneficiaries can access necessary medical services without undue financial burden. Careful judgment is required to interpret and apply the regulations in a way that is both compliant and ethically sound, prioritizing beneficiary well-being. The correct approach involves designing tiered cost-sharing structures that align with Medicare's objectives, such as promoting the use of lower-cost, clinically appropriate services, while ensuring that essential services remain accessible. This means that the tiers should reflect meaningful differences in cost-effectiveness or value, and the out-of-pocket costs for beneficiaries should not create a barrier to receiving medically necessary care. Specifically, Medicare regulations permit tiered cost-sharing, but it must be structured in a way that does not discriminate against beneficiaries with chronic conditions or those who require more complex care. The justification for this approach is rooted in Medicare's mission to provide health insurance to eligible individuals and to ensure that they can afford necessary medical treatment. Regulations governing Medicare Advantage plans, for instance, require that cost-sharing be reasonable and not exceed what is permissible under traditional Medicare, and that plans do not impose discriminatory benefit designs. An incorrect approach would be to implement tiered cost-sharing based solely on the perceived profitability of a service or provider, without considering the clinical necessity or the impact on beneficiary access. This fails to adhere to the regulatory framework, which emphasizes the provision of medically necessary services and prohibits discriminatory practices. Another incorrect approach would be to set the cost-sharing for higher tiers so prohibitively high that beneficiaries are effectively discouraged from accessing services that, while potentially more expensive, may be clinically indicated or offer better long-term outcomes. This violates the principle of ensuring access to care and could lead to adverse health consequences for beneficiaries, contravening the spirit and letter of Medicare regulations. A third incorrect approach would be to create tiers that are not clearly defined or communicated to beneficiaries, leading to confusion and unexpected out-of-pocket expenses. This lack of transparency is a failure in both regulatory compliance and ethical patient communication. The professional reasoning process for similar situations should involve a thorough review of the specific Medicare regulations pertaining to the plan type, e.g., Medicare Advantage, Part D. This includes understanding the permissible structures for cost sharing, any limitations on out-of-pocket expenses, and prohibitions against discriminatory benefit designs. Professionals must then evaluate proposed cost-sharing structures against these regulations, considering the potential impact on beneficiary access, affordability, and health outcomes. A critical step is to assess whether the tiered structure genuinely promotes cost-effectiveness without creating barriers to necessary care. Engaging in transparent communication with beneficiaries about the rationale and structure of cost sharing is also paramount.